A 30-day period under HHGM is new. It's going to require the agencies to really think about how they set up their plans of care with the patient. We're going to need to reevaluate those plans of care within the first 3 weeks of the episode. Before we had 60 days to complete an episode, and now it will be a 30-day period. Now that the episode is shorter, we really need to focus more in that first 7 days to make sure we are meeting the patient's needs. We have 24 to 48 hours to go out and to see those patients. The sooner we get out there, the better we can impact the patient's health care and keep them out of the hospital. So we do a timely start of care, and then we need to set up a plan of care in conjunction with the patient that will help them achieve their goals. We should really see that patient 3 times in that first 7 days, which is called front loading, to keep the patient out of the hospital. During that time, we teach the patient proper medication management, how to manage their disease process, and nuances about their disease process. After that first week, it continues to be important to help the patient to understand how important it is to have the clinicians in their home and to continue to monitor them and to educate them to meet their goals. During the 3rd week of the episode will become the time when the patient needs to be reassessed to see if there's an additional 30-day period that will be warranted to help the patient meet their goals.
Under the proposed HHGM rule, home health agencies' LUPA payments will be impacted by, first of all, reducing an episode from 60 to 30 days, and then creating 144 payment groupings based on the diagnosis and HIPS code. Those 144 payment groupings will then be reduced to 6 LUPA thresholds. Those LUPA thresholds are grouping those 144 payment groups into thresholds where LUPAs will be determined by anywhere from 2 visits to 6 visits. We're going to help agencies prepare by obviously monitoring the regulations, watch what the final rule says, and then we're going to start to adapt those changes to our current client base and start to train them on the different regulatory changes around how's the billing process going to differ. We're going to be ready to help you monitor and move forward with those.